Hi everyone, my name is Tan Pei Sing and my matric number is 298179. I would like to introduce for the health psychology, health behavior and wellness. First, according to the WHO, which is World Health Organizations, health is a state of total physical, mental and social well-being and not just the absence of disease. There are three domains of health, which are physical, psychological, and social health. Physical health defines the correct performance of the body and health without a disease. Psychological health refers to being able to think logically, have good self-esteem, having control over emotions, and the ability to handle stress. Social health is connected with the possibility to develop and sustain relations between people. Now we talk about the wellness. Wellness is defined as an ideal health conditions and focus on balance, personal development, and involvement in healthy activity. There are 7 dimensions of wellness, which are environmental, intellectual, emotional, spiritual, physical, social, and time wellness. The dimensions are linked and they define the general lifestyles and well-being of a person. In health behavior, it can be defined as the everyday behaviors, lifestyle habits, and individual habits that affect an individual health and chances of disease. These behaviors are diet, physical activity, smoking, alcohol use, sleeping patterns, coping with stress, and involvement in preventing health service. Recent behavioral statistics also indicate that Malaysia is seriously challenged in terms of healthy lifestyle promotions. According to the National Health and Monitoring Survey 2023, 29.9% of adults are not physically active and 49.9% of adults spend much time sitting at work. Research shows that most of the Malaysians, which is 95%, prefer junk food, soft drink, and high-fat foods. These eating habits contribute to obesity and metabolic disease. The Ministries of Health Malaysia carry out a survey that shows that the chronic diseases are common in Malaysia. As in illustrations, 15.6% of the adults in Malaysia are diabetic, 29.2% are hypertensive, with over 54.2% being overweight and obese. The high rate of obesity put Malaysia in the list of the fattest country in Southeast Asia and pose a major threat of developing diabetes and cardiovascular disease.
My name is Ki Xiang Yi. My matric number is 302304. Today I want talking about the current issue in mental health. Mental health is an essential part of our health. It includes how we thinking, feel, and behavior in our daily life. Good mental health help individuals cope with stress, make decisions, and maintain relationships. In Malaysia, mental health has become increased concern, especially among young people. Many young face academic pressure, financial stress, and social challenges, which can affect their emotional well-being. In statistics, clearly show seriousness of this issue. According to the National and Mobility Survey 2019 years, 29% of adults in Malaysia experience mental health issues. Among adolescents, 1 in 3 show signs of stress, anxiety, or depression. Majority of Health Service MOH survey in 2022 find that over 15% of young age 16 to 29 feel mental distress, and the situation became worse during the COVID-19 pandemic. So there are 2 important factors in mental health. One is the stress. As students and adults often experience stress from academic demands, work pressure, finance problems, and family responsibilities. When stress is not managed properly, it can run to intense depression, emotional isolation, and burnout. Another factor is social media. Influence of social media. Social media often promotes idealized standards of success, beauty, and lifestyle. This leads to complex comparison with others, which can lower self-esteem and create feeling of insecurity. Social media also expose individuals to cyberbullying and negative online comments, which may cause anxiety, sadness, and emotional withdrawal. They feel missing out or FOMO increase physiological pressure and keep people constant connect. So over time, reduce face-to-face interaction, sleeping problem, and emotional instability increase the risk of mental health issues such as depression and anxiety. So, in the impact of mental health, we get 4 points. The first point is reduce workforce productivity. First, actually, mental health problems can reduce workforce productivity. People who experience depressed anxiety or emotional instability often find it difficult to stay motivation and perform well at work or in their study. The second point is increased health care costs. Mental health issues can lead to increased health care costs. Individuals may request long-term treatment, counseling, or medication, which increases the burden on the healthcare system. The third point is greater social dependence. In addition, mental health problems may cause greater social dependencies. Some individuals may struggle to work or study, learn to an employee, and depends on family support or government assistance. And the last point is slower national social and economic development. On a large scale, poor mental health can slow down national social and economic development. When a large portion of the population is mentally unwell, overall productivity decreases and national progress is affected. Therefore, mental health is not only personal issue but also important public health and social issue that need serious attention.
Alright, next, the current issue in health behavior Malaysia is unhealthy lifestyle. An unhealthy lifestyle refers to daily behavior patterns that negatively affect physical and mental health, including poor dietary habits, smoking, alcohol consumption, and insufficient sleep. In Malaysia, unhealthy lifestyles have become increasingly prevalent and are a major contributor to non-communicable disease (NCD), such as obesity, diabetes, and cardiovascular disease. According to National Health Mobility Survey (NHMS) 2019, over 50% of Malaysian adults are overweight or obese, and 21% adults are current smokers.
Poor eating habits refer to diets high in sugar, saturated fats, and also salt. It combined with low intake of fruits, vegetables, and fiber. In Malaysia, rapid urbanization and lifestyles change have increased dependency on processed and convenience food. According to National Health Morbidity Survey 2019, only 5% of Malaysians meet the recommended daily intakes of fruits and vegetables, increasing the risk of obesity and metabolic disorders. Several factors contribute to poor eating habits, including the easy availability of fast food, time constraint due to work demands, and psychosocial stress that encourage emotional eating. Aggressive food marketing and also social norms further normalize unhealthy dietary choices. So now we move on to part smoking. Smoking actually is a risky health behavior that contributes significantly to morbidity and mortality associated with chronic disease. Exposure to toxic substances such as nicotine, tar, and carbon monoxide will damage the cardiovascular, respiratory, and metabolic system. In Malaysia, it's about 21% of adults are current smokers, with higher prevalence among males, sustaining population level of chronic disease risk. So now we move on to part factors. Actually, we have several factors that reinforce smoking behavior, including nicotine dependence, peer pressure, cultural norms, psychosocial stress, and also work demands, the easy availability of tobacco products further limits cessation efforts.
Alcohol consumption is a significant public health concern in Malaysia. It presents a major risk for chronic disease and preventable injuries, as it has toxic effects on vital organs, including the liver, the cardiovascular system, and the central nervous system. Of particular concern is the persistence of problematic drinking pattern among both adolescents and adults in our society. Supporting this, national data revealed that 11% of Malaysian adults engage in regular alcohol consumption, while 3% participate in the high-risk behavior of binge drinking, highlighting a clear need for continued awareness and intervention. Factors that contribute to alcohol use in Malaysia. The behavior is often driven by stress, where individuals use alcohol as a coping mechanism for emotional or work-related pressure. Peer influence and prevailing social norms also play a powerful role, making drinking a common feature of social gatherings. Furthermore, socio-economic pressure and demanding work environments can exacerbate this issue. These factors are compounded by pervasive media exposure and target alcohol marketing, which often glamorizes drinking, making it appear as a normalized and desirable part of modern life. Insufficient sleep is identified as another major public health challenge affecting Malaysians across age group. Chronic sleep deprivation is scientifically linked to serious health consequences, including metabolic disorder like diabetes, cardiovascular disease, and a compromised immune system. This crisis is fueled by hallmarks of our modern lifestyle: immense work pressure, academic demands, and the pervasive use of electronic devices before bedtime. These statistics are 16% of adults and 14% of working adults in Malaysia are consistently not getting the sleep they need, underscoring the widespread nature of this issue. The primary factors include excessively long working hours and increased academic demands, which drastically cut into available rest time. Weak sleep and pressure to screen from phone and laptops disrupt the body's natural production of sleep hormone. Psychological and emotional stress creates a mental barrier to falling and staying asleep. Additionally, irregular sleep patterns such as vastly different bedtime on weekends confuse the body's internal clock. Together, these factors create a vicious circle that negatively impact both immediate well-being and long-term health outcomes.
Overall, unhealthy lifestyle behaviors, including poor eating habits, smoking, alcohol consumption, and insufficient sleep, significantly increase the risk of obesity, type 2 diabetes, hypertension, cardiovascular disease, and certain cancers. These behaviors impair metabolic regulation, cognitive functions, and immunity, which elevates accident risk and collectively contribute to Malaysia's growing non-communicable disease burden and healthcare costs.
Now we are going to talk about the current issues in health behavior Malaysia, which is youth suicide. Suicidal attempts have been increasing at an alarming rate among the young populations in Malaysia in the recent years. Based on the recent statistics released by Royal Malaysia Police given by government officials, 5,857 cases of suicide occurred between the year 2020 and October 2025. Among these, 1,813 were between the age of 15 to 30. These statistics underscore the fact that suicide among young adults is not a peripheral matter, it is a national problem. The National Health and Monitoring Survey 2022 also discovered that 13.1% of Malaysian teenagers aged 13 to 17 report having suicidal ideations, 10% plan to commit suicide, and 9.5% actually attempt suicides. Moreover, mental health issues in children, teens, and young adults have also grown significantly, with 7.9% in 2019 being replaced by 16.5% in 2023. Studies and official statistics shows that the problem is not caused by one single factor, but rather a mix of psychological, social, economic, environmental, and cultural stress that the Malaysia's young experience nowadays. Bullying and peer victimizations are significant risk factors that contribute to youth suicides. 6.9% of Malaysia's secondary school students have attempted suicide, and students who have been bullied were found to be 4 times more likely to attempt suicide than those who have not been bullied. Cyberbullying introduced a new twist, particularly as the Malaysian youth spend more time online. Physical, verbal, or digital bullying hurt self-esteem, instill continuous fears and alienations, and may cause long-term emotional trauma, which lead to suicidal ideations. The environmental and social conditions are also significant risks. The relationship between high-density, low-cost living conditions and suicidal behaviors among young people has attracted the attention of government reports. The Deputy Health Minister says that suicide and mental distress within the youth populations is more common in such high populations urban living conditions, where stress factors are higher and without the supportive environments. Issues in the family and academic pressures are also important factors. Malaysia's young people are under strong pressures to achieve better grades, excel in the financial world, and match their parent expectations. Their mental conditions may get even worse due to family conflict, domestic violence, or the lack of emotional support. Stigma related to mental health is a strong root cause of old age and has hidden many young seeking help. Even though there are services like the HEAL 15555 counseling hotline, many young people are afraid to do so because they are afraid of their judgments, stereotyping, or being misinterpreted by parents, teachers, or peers. It has been reported that some of the youth even pick up hotline calls and leave them before talking, which prove how stigma and shame are obstacles to life-saving support. Mental health is covered in silence, making the issues even more serious since numerous cases are unreported or undisclosed. Suicidal thoughts among the Malaysian young people are grave and are not only in individual levels but also on family, community, as well as national developments. At a personal level, suicidal behavior greatly interferes with psychological functioning and life pathways. Suicidal thoughts frequently occur in young individuals with a long-term history of emotional distress, such as depressions, anxieties, and hopelessness that negatively affect both academic and social competence. Suicide attempt survivors can also have sustained psychological trauma or physical problems that put them at risk of reattending and restrict future educations and employments. The family effects are far-reaching and long-lasting. Attempt suicide by the young usually leads to several emotional distress to parents and family members, such as guilt and trauma. The relatives can be affected by long-lasting mental health and social isolations, especially under the conditions when suicide is highly stigmatized. On the national level, youth suicide is a great loss of human capital. The teenagers and young adults are a crucial components of the workforce in the future. Death or disability due to suicide attempts will reduce productivity and burden the economy. There are also extra expenses associated with emergency treatment, counseling service, and support system, which put pressures on the medical and welfare industry.
Sometimes, I wish I could make them see, to make them feel the pressure that waits on me every day. But instead, I'm left here, alone in my thoughts, surrounded by noise, and no one notice.
Apa yang stress-stress ni? Kan awak masih kecil.
Awak ni stress apa? Kami lagi stress.
I try to explain, but it's like my words get lost in the air. No matter what I say, it feels like they never reach anyone. I just want to be here, but I feel invisible. The more I try, the more distance I get. Why they all so perfect? Why I can't be like them? The more I scroll, the more I feel like I'm falling behind, like I'm not good enough. I keep eating even though I'm full. I tell myself it's okay, but I know it is not. I'm trying to feel an emptiness, but no matter how much I eat, it never feels like enough. The discomfort grows, but I can't stop. I feel sick, yet the urge won't leave. Nothing fills this emptiness. I keep nodding off, my head dropping with every blink. Every minute feel like a battle to stay awake. When I get home, I'm exhausted, but sleep won't come. I lie down, but my mind won't stop racing. I toss and turn, and the more I try to sleep, the more awake I feel. I light the cigarette, the smoke filling my lungs, and for a moment, everything fades away. The noise in my mind quiets, even if just for a few seconds. But it doesn't last. I take a drink, the burn hitting my throat. It numbs me, letting me forget for a while, but deep down, I know it's just another temporary escape. I keep smoking, drinking, and escaping. I keep writing, but nothing makes sense. My mind won't focus, and the slides blur together. The pressure's overwhelming, and I'm falling behind. I can't catch up. I can't move in this moment. I'm lost, helpless, trapped in a place where I can't escape.
No one let me. Lebih baik. Tadi hidup.
I look down, and dark thoughts begin to take over. It's time to end all of this, all my pain and struggle. If you are struggling or facing any mental health challenges, remember, you are not alone. Reach out for support. Someone is always there to help. Addressing mental health and chronic illnesses requires a comprehensive approach. Different sectors play crucial roles in offering treatment and support. First is government support. The government offers vital healthcare services, including mental health support via public hospitals, the HEAL 15555 helpline, and financial aid schemes like PECA B40 for low-income individuals. Second is private sector. For those who can afford it, the private sector provides quicker access to specialized care and services, reducing waiting times and improving treatment options. Third is community and religious support. Community-based support systems, including religious organizations, provide financial aid, medical assistance, and other resources like meal deliveries and transportation. Fourth is family caregivers. Family caregivers are essential for daily care, but they often lack formal support. Providing better resources and recognition for caregiver is crucial to ensure sustainable care. Fifth is digital innovation. Digital platforms like MySejahtera offer a way to connect patients to healthcare fundings and telemedicine service, making care more accessible, especially for underserved communities. The government plays an essential role in providing healthcare, especially for individuals facing chronic diseases and mental health challenges. Through the Ministry of Health, public healthcare services like Klinik Kesehatan and public hospitals provide highly subsidized treatment and medication, ensuring accessibility to healthcare even for those with financial constraints. These facilities are crucial for managing both physical and mental health, as they provide care at a low cost, making it possible for the general public to receive medical attention. In addition to physical healthcare services, the HEAL 15555 helpline is a vital resource for mental health support. It offers free counseling, emotional support, and crisis intervention, which has proven essential, especially with the rise in mental health issues. The helpline ensures that individuals who need urgent support can easily access it without the fear of cost. For low-income individuals, the PECA B40 initiative further provides screening, medical devices, and transport aid, easing the financial burden of seeking treatment and allowing more people to access the care they need. Despite these efforts, the public healthcare system still faces significant challenges such as long waiting times and delays in specialized care, which can negatively impact patients. Furthermore, the Department of Social Welfare provides financial support to vulnerable populations such as the poor, elderly, and persons with disability. This assistance, which includes monthly allowance and the provision of assistive devices, is vital in helping people cope with medical and living expenses. However, the application process for financial assistance can be complex, and approval is often slow, which means individuals in urgent need may experience delays in receiving support. In Malaysia, zakat plays an essential role in supporting those in need, particularly for medical costs, medications, and daily necessities. Distributed through mosques and religious bodies, it provides personalized, fast help, including meals, transport, and temporary housing. This system is deeply rooted in social solidarity, ensuring that individuals facing financial struggles have a support system. However, while effective, the availability of zakat is often limited to certain communities, and it's not always sustainable in the long term. Moving to the private sector, The private sector offers an alternative for those who can afford it, providing quicker access to healthcare services through private insurance and employer health plans. However, these come with high premiums, co-payment, and often exclusion for pre-existing conditions, making it difficult for individuals needing long-term care. To cope, some people rely on EPF withdrawal for medical treatment, while others turn to SOCSO for work-related injuries and disability coverage. While the private sector offers benefits such as shorter waiting times and specialized care, the costs associated with it remain a barrier for many. NGOs play a vital role in filling the gaps between public and private healthcare systems. Health NGOs such as National Cancer Society of Malaysia provide screening, transportation, and support groups, ensuring access to critical healthcare services. On the mental health front, organizations like Befrienders and MIASA offer counseling, helplines, and work to reduce the stigma surrounding mental health issues. Despite the importance of their work, NGOs face funding limitation and high demand, which limits their capacity to fully meet the growing need for their services. In Malaysia, there is a heavy reliance on unpaid family caregivers for individuals with chronic health conditions and disabilities. These caregivers, often family members, provide daily support, but their role comes with significant challenges. The financial strain, burnout, and mental health risks faced by caregivers are often overlooked. They lack sufficient support in terms of training, respite care, and funding to help them manage their responsibilities effectively. In terms of rehabilitation services, there are significant gaps. Public rehabilitation services often have limited access and long waiting times, which can delay recovery and worsen patient condition. On the other hand, private rehabilitation services can be very costly with high out-of-pocket expenses that many cannot afford. These gaps in rehabilitation and caregiver support highlight the need for a more robust and accessible system. Digital innovation plays a critical role in improving healthcare access and efficiency. MySejahtera, a digital health platform in Malaysia, can be used as a tool for funding and care coordination, allowing patients and caregivers to connect with healthcare providers more easily. Additionally, telemedicine has proven to be effective in reducing transportation and indirect costs by providing remote consultation, making healthcare more accessible, especially for those in rural areas. However, there are challenges, including the digital divide that affect the elderly, rural, and low-income population who may not have the resources to access digital platforms. To address this issue, there is a need for better inter-agency coordination, stronger public-private partnership, and enhanced public awareness of AID scheme to ensure that everyone can benefit from digital healthcare innovation.
In conclusion, health outcomes in Malaysia are shaped by lifestyle behavior and psychosocial factors. Rising mental health issues, unhealthy lifestyle, and youth suicide demand urgent action. Chronic disease management requires multi-sector support, such as government, NGOs, private sectors, and family caregivers. Existing schemes such as PEGA B40, Health 15555, NGOs are essential but insufficient. Gaps remain in funding, access, and rehabilitation service. Therefore, digital innovation and public-private collaboration offer future solutions, where a holistic, sustainable approach is needed to improve population well-being. To conclude in one sentence, improving health in Malaysia requires not only personal responsibility, but coordinated, well-funded system that supports individuals across every stage of illness and recovery.